I'm Dr. Jacqueline and I'm going to talk about dental veneers today. Dental veneers are basically a thin coating of some material that is placed on top of your natural teeth. There are two materials that we generally use for this purpose. One is porcelain and the other is resin or plastic. So a dental veneer can be used to change the color of your teeth. It can also change the shape or the length of your teeth. If you're considering dental veneers because you've seen them around on social media, maybe you've seen some celebrities who had like a smile makeover with dental veneers, then you might be wondering, will you be suitable for the same thing? The short answer is, it really depends on what your treatment expectations are and what you would like to achieve at the end. So I would strongly suggest that you consult with your dentist to see if dental veneers will be suitable for you. So you might be wondering if you can skip straight ahead to dental veneers without first aligning your teeth using braces or Invisalign. And again, the answer is it depends. If you've had previous orthodontic treatment, maybe as a teenager, and your teeth are relatively straight with some minor crowding, then sometimes realigning the teeth before having veneers done is not really going to give you a lot of benefit. However, if you have quite severe crowding or overlaps of your teeth, I would strongly advise a round of straightening before we do veneers for two reasons. Number one, veneers can correct tooth position, but only to a certain degree. And if your teeth are very overlapping, then the amount of space that's available for the veneer may not be proportional. So when you smile at the end, it's not going to look nice. And also, if your teeth are very overcrowded and there's a tooth that's sticking out and you want to bring it into line with the other teeth, you have to cut off quite a lot of that tooth. So that will mean that the tooth is now at risk of either breaking off in the future, or you might even need root canal treatment. So all of this is not worthwhile for a cosmetic procedure such as dental veneers. So if you have quite severe crowding, pre-veneer treatment like straightening your teeth with Invisalign or braces is a good way to preserve as much tooth structure as possible, because if your teeth are in the right positions, we don't have to trim so much of the tooth structure away in order to make you a nice looking veneer. A dental veneer case can vary in terms of timeline. So for example, if you are not treating a lot of teeth, maybe you just need like 1 or 2 teeth done, and you're not really changing the look of the teeth too much, then it may be quite quick. You might be able to complete the whole process in maybe like 1 or 2 months. But for example, if you really want to change a lot of things about your smile, like the length, the position of the gums, and so on, or if you need pre-veneer treatment such as braces or Invisalign, then the whole process can take months or sometimes even years, depending on the combination of treatments that you need. I don't think that it's wise to be put off dental veneers if really your case requires a longer time to complete, because all the steps that we need to do is to make sure that you get a nice result in the end. So again, it's really case dependent and patient dependent as well. If you do have a timeline that you need your dentist to work to, for example, if you are getting married or if you're planning to move overseas, then it's really important to bring this up at the first appointment. Sometimes we can make things look better, but maybe it's not complete by that deadline, and your dentist will be the best person to advise you. Generally, dental veneers or any dental procedures should not be painful because it's done under local anesthetic, so you will need to take some injections in the gums to numb the teeth and the gums as well. After the procedure, your gum or your lips might be sore from the retraction and from the injections themselves. Considered to be one of the least painful dental procedures that you can have done, with very little downtime after that. The experience of the dentist doing dental veneers also really depends on like their interest and also their scope of practice. So you can have very experienced dentists who've been working for a very long time, but their workload may not be a lot of aesthetic cases or not a lot of veneer or crown cases. So I find veneers like very fun to do because everybody knows it's cosmetic, and both myself and the patient are invested in getting a really nice cosmetic outcome. And there are certain things which someone who's focused on veneer treatments or cosmetic dentistry treatments in general will be more sensitive to. So for example, like the shapes of teeth, there are like subtle details that we need to look after in order to make like a nice and natural looking set of veneers, something that doesn't look so fake. And some patients may be quite particular about certain aspects of the color. So color is not just how white or how dark the veneers will be, but things like surface texture, translucency, and all these like little details. So if you're not a dentally trained person, I've seen like beauticians offering like veneer treatments on carousel. You're not sure if you're getting like the benefits of a trained professional, and also the materials that they're using are not going to be as long lasting as what a licensed dentist will be able to offer you. So for example, if a patient had some veneers done elsewhere, not with a licensed dentist, after a few years, like when things start to break down and start to look ugly, and we are planning to redo the case, usually we would want to choose a better material like porcelain so that it looks nicer for a lot longer. So I know it's tempting to like, I want to save money and just go to some random person, but I mean, in the end, it's like the health of your teeth, because to make something look good in the mouth is not difficult. Like anyone can do it, but to make it biologically compatible, to make it cleansable and hygienic and make sure that you can function, you can eat with it, that is the hard part. And that is what dentists are trained to deliver. And that is reflected in the fees of the treatment as well. So just be mindful of this aspect when you are choosing who to see for your dental veneer treatments. Okay, so that was everything you wanted to know about dental veneers, but I'm sure this video has triggered even more questions. So leave your questions, comments, and feedback in the comment section below. If you want to see more dental videos, or even ask me questions about dental veneers, you can follow my Instagram at Dr. Jacqueline To. I will leave the Instagram link here, and I'll see you guys next time.